Hey, it's Dr. Schmidt. I wanted to talk about something that I think can save your life. I became a doctor because I wanted to improve people's health. I became a surgeon because I liked surgery. I liked working with my hands. I liked doing something and fixing a problem. If someone had appendicitis, you take their appendix out, and they're well. And I did not like the idea of treating chronic diseases. It did not appeal to me. And really, that's just become full circle in my career because I cure diabetes. Type 2 diabetes can be cured for people who are obese if they have weight loss surgery. It's been shown time and time again. I call it cure because my patients tell me their sugars are normal and they don't take their medicine anymore. And years and even now decades of my own patients, decades later, they're still not taking medication. So when people have weight loss surgery and they lose the weight, their type 2 diabetes goes away, and you may call it remission. It stays gone as long as you keep the weight off, and most of my patients do keep their weight off. I have to tell you this because your diabetes doctor is not going to tell you. It's really bothered me this week. I talked to lots of patients throughout the week, and this week I've talked to two different patients, and we got off on the subject of their diabetes and their doctors, and in fact their endocrinologist, who is a diabetes specialist. A diabetes specialist knows that weight loss surgery cures or sends into permanent remission type 2 diabetes, but they don't tell their patients about that. One lady I talked to today said that her endocrinologist was trying to talk her out of the surgery and telling her no, she should try these shots, she should try all his different diet programs. And, I just think there's a special place in, I just think that, let me rephrase, I just think that's horrible. People deserve to have their diabetes cured and not treated for years until their feet go numb with neuropathy, until they lose their eyesight, until their kidneys fail, until they have heart attacks and die. So I know most of my patients, because I see how people respond on Facebook, I know most of my patients love the fact that they lose a lot of weight and look better and feel better. But I'm not a plastic surgeon. That isn't not what appeals to me. What appeals to me is prolonging people's lives, giving them a better quality of life. So your doctor is never going to tell you, or very few doctors are going to tell you that, hey, let's stop giving you all these pills, these handful of pills that I get paid for to give you. I'm going to send you to a doctor, a weight loss surgeon, and let you be cured of your diabetes or your hypertension or your high cholesterol or your sleep apnea, because it'll do all those things. So I have to tell you that, and make no mistake about it, I get paid for doing the surgery and I get paid well for it, and I feel blessed. But I know that what I'm doing is the right thing. And if you don't like me, if you don't like Alabama weight loss surgery, find a doctor you trust and don't walk to him, run to him, and improve your health and live longer for yourself and your family.